To speak more on this, we're joined by Adewale Adeduntan, Social Mobilisation Manager at ActionAid Nigeria. Warm welcome to you, Mr. Adeduntan, and thanks for joining us at Nigeria tonight.
Good evening. It's my pleasure to be here with you. Thank you for having me.
We're happy to have you. Now, cases of medical negligence is one too many in Nigerian hospitals, both in private and public sector. Why do you think this remains a prevalent issue?
When we talk about medical negligence, like you mentioned, it's becoming persistent in our hospitals, both in private facilities and public facilities. And there are several factors that could be contributory to this. One of which is the fact that we have to call a spade a spade. Inadequate training and education is one of them. I'm not saying generically or using blanket statement to say that doctors in Nigeria are not well trained. That's not the situation, but you can be sure that in some of the institutions where we have training for medical doctors, you could see the industrial actions being embarked upon at some point by NMA and ASU and other professional bodies about the fact that it's important for us to ensure that we devote more resources to the health facilities, but particularly the ivory towers. Again, we also have to consider issues around understaffing and getting doctors being overworked. This is also another contributory factor. And of course, this is also traceable to resource constraints that we know is a big issue that all stakeholders have been talking about. But more importantly, I would say categorically that we also have to beam the searchlight around concerns on inadequate supervision and oversight. This is important. Who is supervising what is being done and all of that? And more importantly, again, lack of accountability is also what we have to also think around. And of course, communication challenges in terms of passing the issues that patients are going through to their loved ones. If communication is not thoroughly and properly communicated, it could lead to kind of challenges that we are having now. So
now, still talking about this case of the late Adebola Akin-Bright, there seems to be an attempt to cover up something. The doctor being accused of misconduct said it's impossible for someone to survive for 28 days without the small intestine, suggesting that whatever led to the boy's death is not being told to the public. You're not a medical doctor, and all doctors we've reached out to on this story declined to comment on camera. But you follow this case since it began. What do you make out of this, and what steps would you recommend to ensure that the proper culprit is identified instead of rushing into conclusion that may turn out to be an error?
Okay. With the situation of this case, because investigations are still on, I would not want to sound prejudiced, and I would also want to align myself to the fact that we should wait until we see the outcome of the investigations being conducted. However, it is important that where we have this kind of occurrences, whoever that is found guilty must face the full wrath of the law. Because here we are talking about the right of a child. It's very, very unfortunate that this has happened. And as much as possible, it is important that thorough investigation must be conducted while we give everyone the benefit of doubt that we should have this thoroughly investigated and ensure that we see the outright reasons and how this actually happened. So that's why I would like us to hang it. But what is important is that we must come to a point in our national life where regulatory steps and sanctions must be meted out to people who are found guilty.
Thank you very much, Mr. Adewale Adeduntan. I'm afraid we'll have to end the conversation here. Thanks for your time and your insights. We appreciate it. Thank you.
All right. Thank you very much.